Hi everybody and welcome back. Our first guest today is a doctor of audiology who helps people with hearing loss and hearing issues. She established A. Bell Audiology Associates and Musicians Hearing Center back in 2003. She is certified in hypnosis and intuitive intelligence. Her goal is to maximize hearing and listening by using holistic approaches. Please help me welcome Dr. Paula Lubinsky.
Hi, how are you?
I'm doing
Raina.
well. How
Thank
are you?
you for having me.
Thank you for having me. So you are a doctor of audiology. How did you get
Yes.
into that? That's very interesting.
I'm glad you asked. Well, when I was young, I have a cousin who's 10 years older than me, and she was a teacher for the deaf. So I started out wanting to be a psychologist, and then I decided I would be a psychologist for the deaf because it's a very unique
Absolutely.
kind of practice. And then I started going to school, and I decided maybe the psychology wasn't the primary thing I wanted to do.
Like we all go through, right?
So I started taking classes, and I found the audiology, the science of it was just fascinating. Plus, it still allowed me to use all the psychology skills as well.
Absolutely. So I mean, because I have hearing issues, and I was born with hearing issues. I had to have tubes and surgeries, and they want me to get hearing aids eventually, but I'm a little too young for that still. So you use a holistic approach. So what is different about that?
So what I do very scientific diagnostic tests, obviously.
Okay.
As a doctor of audiology, we do the scientific diagnostic tests. And we use the regular tools for treating hearing loss, such as hearing devices, which I have to tell you, they've gotten so... Hearing devices these days are so technologically advanced and actually very sexy these days, I have to say.
Are you trying to sell me on something?
No, I'm just trying to change the image of what hearing aids are these days, because they're not the hearing aids of 35 years ago when I started.
Absolutely.
But we also use other techniques such as oral rehabilitation, and we have great tools for oral rehab because my belief is that we hear with our ears, but we understand with our brains.
Absolutely.
So even though we may be actually physically hearing something, our brain may either not be understanding it, or because we have the conscious and unconscious minds, we listen differently through the conscious and unconscious and filter things to listen through those filters. So I use all kinds of tools to help my patients really become better listeners so that they can really connect with themselves first.
Absolutely.
Because some people just really aren't listening to themselves and what they need, and it causes distress in their relationships.
Our society has built that. I mean, we look at a society that's on their phones, it's on their TVs, and we've adapted technology, but we have kind of stepped away from ourselves. And whether it's hearing or listening, which are two different things, I think it's a great approach to start integrating different, combining, a Western philosophy with Eastern. As you know, I'm into Eastern medicine, so I believe in that realm. But you have to look at it and say, well, our society has to change to listen to ourselves, because that's the only way we're going to learn to adapt to who we are.
Absolutely. I couldn't agree more.
So what is the do? I mean, you do also the audiology, but talk a little bit about the hypnosis too.
So what I do with the hypnosis, I actually started hypnosis because the thought process of one of the things that I diagnose and treat is tinnitus, or ringing in the ears.
Yes.
And that's a whole different show unto itself. But one of the things that I've always used for tinnitus, aside from sound therapy, is tinnitus retraining therapy.
Okay, what is that?
So tinnitus retraining therapy, when we get ringing in the ears, or tinnitus or tinnitus, it can be either one. It starts in our ears, but it winds up at the limbic system of our brains.
Yes.
So we can use methods to retrain the limbic system to realize that the sound is not a threat to us.
Yes.
And so I started using hypnosis to treat my tinnitus clients to help the limbic system realize that this tinnitus was not a threat to them. And so when I used to do tinnitus retraining therapy, it could take up to a year and a half because there was a lot of cognitive behavioral therapy.
Yes,
And it was a lot of games and other things, but it was a lot of cognitive behavioral therapy. But hypnosis gets rid of it 3 months.
Wow,
tops.
really? You know, people have a lot of, stigmas about hypnosis, and, you see it on TV and you really don't know what it is, and a lot of people are fearful, especially, like I obviously like to be in control a lot of times, and, for me to go under and relinquish that power, especially to someone, and I trust you, you're a wonderful person and everything, but to someone who doesn't know someone, what are the fears going into that? Because, I mean, they're kind of giving up that control.
Yeah,
that's
a really good question. That is a really good question. So actually, the way I do hypnosis with somebody, it's not, it's not like what you see on the stage.
Absolutely.
And hypnosis, the way I do it, it's a bridge
Okay.
between the conscious and the unconscious. So when you're in a hypnotic trance, you're more in control
Okay.
than you actually are in a waking state. So in a hypnotic trance, and people go into different stages of hypnotic trances, you are in complete control. You would never, ever do anything while you're in a hypnotic trance that you wouldn't normally do in a waking state.
So it's not like it's not a very deep type of loss of control. It's more you're functional. You kind of know where you're at, but you're at a very. Would you say you're at a alpha wave or a theta wave?
Well, you can do alpha, theta, delta, any of those.
Okay.
It depends really what your intent is, what you want to solve or change, or what information you want to access in your unconscious brain to be more functional in your waking life. Because your conscious mind gives you all these filters. You want to do something. You want to start a business. You want to change the way you're in a relationship. And your conscious mind is saying, oh, well, that never worked out for you before, or what, are you crazy, or you don't have the money to do that, or you don't have the gumption to do that.
Correct.
So taking out those filters and going directly into the unconscious mind builds confidence and changes your thought process so that when you come back into a waking state, it's much faster than affirmations. It's much deeper than affirmations, which I think are great. However, it allows you to come back thinking, wow, I really can do it. It really gives you more confidence in your core to come out and say, I can do this.
So basically, we are reconfiguring our neural pathways or our conditionings.
Yes.
Would you say? Absolutely.
Absolutely.
Well, that is very interesting, and I want to thank you for joining us today, Dr. Paula. You have been an amazing guest.
Thank you.
And, I met this lady a little bit ago, and I got to say she's an amazing woman. She has an amazing practice, and I know she can help you, and I'm interested into having what she can hear. So
Thank you.
How can people get a hold of you?
So there are several ways you can get a hold of me. You can go through my website at www.abelaudio, that's ABELAUDIO.com, or you can reach me on Twitter or Instagram at the handle #AskDrPaula, that's AskDrPaula, or you can always reach me by email at abelcoordinator, ABELCOORDINATOR @gmail.com, or you can call me at 954-435-9779, because from my heart I would love to connect with every single one of you